And good morning, good afternoon, everyone. Welcome to this afternoon's webinar, which is going to look at health research and its contribution to South Africa's democracy. My name is Elizabeth Lutge. I'll be moderating this webinar, and the webinar has been organized by the Academy of Science of South Africa, and I just want to thank Dr. Kutso Pelani for putting it all together. Just a few housekeeping rules to start off with. Please note that everyone's mics have been muted automatically, and they will remain muted until the discussion section, which will start at about 3 o'clock this afternoon. But whilst you're muted, if you have comments or questions during the webinar, please do post them in the chat so that we can raise them on your behalf during the discussion section towards the end. So to begin, how has health research contributed or not contributed to South Africa's democracy? So health research has come under the spotlight a lot in recent years in ways that it hasn't done before. There's been an unprecedented public interest in health research due to the COVID-19 epidemic. Before then, although there was a lot of interest from civil society in certain types of health research, probably most notably HIV research, I think that the interest and engagement on health research during the COVID pandemic has eclipsed any other in the past. This engagement on health research has happened on all sorts of spheres, at all levels of the public. It's happened at dinner table conversations, newspapers, radio, magazines, and probably most notably on social media. And in many ways, this is a very good thing. Research is a public good, and making research available to the public and to society is a manifestation of the democratic principles of freedom of speech and freedom of information. And it's also related to intellectual freedom, which is the freedom to hold and receive and disseminate ideas. And in this webinar, we're going to focus on research as freedom of speech, because we're going to look at how this democratic principle, as it relates to health research, can hold up during a pandemic like the one that we've just experienced. So freedom of speech is directly related to the strength of a democracy. Democracy is self-government by the people, as we know, and in order for people to govern themselves effectively, they need to be fully informed. And in order for people to be fully informed, there needs to be a free flow of information and ideas. Some people believe that this freedom, this free flow of information should be absolute. So for example, the French author Voltaire is famously quoted as saying, "I disapprove of what you say, but I will defend to the death your right to say it." So freedom of speech is the freedom of an individual or a community to articulate their opinions and ideas without fear of retribution, censorship, or legal sanction. And in this webinar, we're going to use the terms freedom of speech and freedom of expression interchangeably. Freedom of speech has a long history, and for centuries it's been an ideal that many societies have striven for. It probably has its roots in ancient Athens. And it's a revolutionary principle. So take, for example, the development of the printing press and how the massification of printing, coupled with the freedom to write and the freedom to read, really changed the whole world. So the right to freedom of expression has been recognized in a number of international documents, for example, the Universal Declaration on Human Rights, and in many countries, including our own South Africa. In this country, it's enshrined in the Bill of Rights of our Constitution, which specifically protects the freedom to receive or impart information or ideas. It protects the freedom of the press and other media, and it protects academic freedom and the freedom of scientific research. So the freedom to disseminate research results and to discuss research in the public sphere is an important component of freedom of speech. However, there are aspects of research as conceived as freedom of speech that do need further interrogation. So, for example, what research gets the most airtime and why? Whose voices are heard? And further, it's important to think about how the public deals with research and research results. So should the lay person have access to any and all research? And how does this access actually further the public good? Because of course, there are limitations to freedom of speech. And these limitations have been justified in that speech may cause harm or offense. And limits have been set on freedom of speech internationally and in South Africa. So, for example, in a public health emergency, it may be necessary to set limits on freedom of speech, freedom of information, and intellectual freedom. And these are some of the questions that we're going to be looking at in our webinar this afternoon. So, should the dissemination and engagement on health research be subject to the limitations that have been set on freedom of speech? What limits should be set, if any? When should the limits be set, if at all? And who should set those limits? How has our experience in South Africa, particularly over the past 3 years, contributed to our understanding of how freely health research should be communicated and discussed in our society? So we're privileged to have 3 distinguished speakers joining us for the discussion this afternoon, and I'm very happy to introduce them to you as they appear on your program. I'll start with Professor Mosa Moshabela, who is Professor of Public Health and Deputy Vice-Chancellor for Research and Innovation at the University of KwaZulu-Natal. Prof. Moshabela leads the Quality Health Systems and Transformation Center in South Africa, which is a collaboration with the T.H. Chan School of Public Health at Harvard University. And he's a faculty member in the HIV, Infectious Disease, and Global Health Research Institute at the University of Washington, also in the US. He's the chairperson of the Standing Committee on Health in the Academy of Science of South Africa, and he holds a number of other appointments, both provincially, nationally, and internationally. Professor Helen Rees is a founder and executive director of the Reproductive Health and HIV Institute of the University of the Witwatersrand, and she's professor at the same university's Department of Obstetrics and Gynecology. She's the co-chair of Wits' leadership flagship program, the African Leadership in Vaccinology Expertise. She's an honorary professor in the Department of Clinical Research at the London School of Hygiene and Tropical Medicine. An honorary fellow, she's been awarded an honorary doctorate of science in medicine by the University of London. She chairs the board of the Health Products Regulatory and also health organizations, AFRO. She's a member of the South African Ministerial Advisory Committees on COVID-19 and on COVID-19 vaccinations. And our third and final speaker for this afternoon is Professor Anton Harber, who is the Caxton Professor of Journalism at the University of the Witwatersrand. He was the founder editor of the anti-apartheid newspaper, The Weekly Mail, which is now the Mail and Guardian. He was editor-in-chief of South Africa's leading television news channel, ENCA, and chief executive of Kagiso Broadcasting. He is a board member of the Global Investigative Journalism Network and a former chair of the South African Conference of Editors and the National Association of Broadcasters. He served on the boards of the Freedom of Expression Institute, the Institute for the Advancement of Journalism, Kagiso Media, East Coast Radio, and Radio Jacaranda, amongst others. He served as a convener of judges and a judge of a number of awards for journalism, and he's the author and editor of a number of books. So we're very happy to have you join us this afternoon, and having introduced the subject and our speakers, I'm very happy to hand over to Professor Helen Rees, who is going to start us off. Over to you, Professor Rees.
Hi, sorry, I apologize. We just had to change devices because I was dropping repeatedly. I do apologize. I've forwarded slides. If the slides could be put up for me, please. Thank you very much. And thanks very much. I thought that this was a fairly easy topic as the scientist, but now when I've heard your introduction, I realized that it's much more complex than I'd realized. And I'm very pleased that Anton Harber, as a journalist, is going to probe us somewhat. So I'm going to look at science communication and why it matters, and I'm going to reflect on COVID-19. And I'm sure that with Mosa, we'll have some overlaps in what our thinking is, but I think that it's worth this to set up the dialogue. Next slide, please. You battling there? Oh, okay. So if we this is going back in time now. This is going back to smallpox vaccines, and I've got a nice quote here because this is a photograph of Edward Jenner, who is the person who established a smallpox vaccine, and I'll come back to that. But the quote is, "In science, credit goes to the man who convinces the world, not the man to whom the idea first occurs." Next slide. And in fact, if we look back at the history of the smallpox vaccine, the earlier version of a smallpox vaccine was actually an inoculation with a tiny bit of smallpox, not cowpox, which is what Edward Jenner did. And it was widely used by royalty and noble people before Edward Jenner developed the smallpox vaccine, but it was politicized. The Whigs were pro-inoculation and the Tory party was against it. And a lot of Tories wrote about how it was dangerous because it was interfering with nature. In the 1798, Jenner then introduced the safer cowpox vaccination. And in 1800, vaccination spread rapidly across Europe. Jenner received worldwide recognition, including from Parliament, but he also was subject to attacks and ridicule in equal measure. And this is a cartoon, a very famous cartoon that shows people getting the vaccine who are turning into cows, because this was now using cowpox. Next slide. So what have we learned from that for COVID-19? Well, the first thing was the positive impact of early celebrity uptake. It was taken up by royals, and then the ordinary layperson took it up as well. There was a political divide even then with anti-vax comments going back in time, a couple of 100 years. Also, an implicit in that was you can't trust scientists. That there was evolving technology. So what started with a smallpox inoculation moved on to becoming a cowpox vaccination. You saw with a cartoon the central role of the media, that there was on the one hand strong support for Jenner from government, but on the other hand, and in equal measure, personal attacks stemming from politics. Now, if I were to put that up with COVID-19 over the top, we'd all say we recognize that pattern, but this goes back to smallpox. Next slide. So if we think about the challenge of science communication during the pandemic, on the left side, I was thinking about what people want. And what people wanted from science was certainty, unchanging results, positive results, reliable results, ethical research, accurate information, agreed upon data, and good public health motives. But some of the things that we had to deal with en route was uncertainty, changing results, negative results, unreliable results, and sometimes unethical research, mis and disinformation, disagreements, and then other motives that drove research. Next slide. So let's go through these and just give some examples of what we were trying to deal with. First of all, uncertainty. And this cartoon says it nicely. Everyone just breathed a sigh of relief, and then comes along the new variants, and we're all sitting on the edge of our seats saying, are we due another one now? So the uncertainty has been there. Next slide. And the uncertainty is also with the science that we're producing. This is something that came out just a few days ago. The uncertainty about what long COVID is. What is it? What causes it? And the idea that perhaps it's caused by microclots, and science has done some experiments and said, no, this is actually rather risky to try and treat that because we don't think that's right. So we have uncertainty that is ongoing as the disease evolves and as the pathology of the disease becomes clearer to us. Next slide. The data is being continuously changing, and no more so than with vaccines. So on the one hand, again, from this month, we're saying, very good news, COVID vaccines slash the risk of spreading Omicron, and so does prior infection. But from the same article, but the benefit of vaccines in reducing transmission doesn't last for long. Now, this is all new information for the public. Next slide. And we've also told the public that vaccines work and they protect you against severe disease, but then come along new variants like Omicron, and then we say, they don't really protect you completely from infection, but they do protect you from severe disease. And the other thing just to note about this continuously changing and these graphics is that they are so neatly held and communicated in cartoons. And those cartoons you can take away, if you don't know a lot, then what would you take away from a cartoon like this? That vaccines don't work at all. You don't have that other subtext message, they protect you against severe disease and hospitalization. That's not there. Next slide. Negative results, and we've had a lot of negative results with just about everything that we've tried, but I'm going back to long COVID, and again, this is a recent one. Long COVID risk falls only slightly after vaccination. So if we were hoping that being vaccinated was going to protect against long COVID, it's now starting to suggest that vaccination isn't, and that some people will get lingering symptoms for quite prolonged periods. And negative results is not what people want to see from research. Next slide. And then there's the unreliable results. And the example I've given here, and there have been quite a lot of these, was a high-profile paper published in a very well-known medical journal called The Lancet, suggesting that hydroxychloroquine, which previously there'd been about 600 plus studies on hydroxychloroquine, many of which were saying that this product worked, but this was a publication that said this actually could be dangerous. And as a result of that, 3 of the 4 authors retracted their work. But we've seen in the course of the coronavirus retractions from scientists around things like concerns about data oversight, the integrity of data, or when challenged because of the integrity of their data. And the problem with this is when scientists retract, the message that goes out is science reliable? Next slide. And then we've had problems with unethical studies. I'm giving this as one example. This was on a couple of studies on ivermectin, which early on was seen as a drug that really could have major impacts both to prevent COVID-19. This was just 2 examples. In the Mexico City study of ivermectin had to be withdrawn because the study itself was conducted without proper consent and appropriate ethical considerations. And the second one, again, with ethics at the core, was a study done by a physician on 4 prisoners in Arkansas jail who were given high-dose ivermectin for treatment without their knowledge. And so the men are subsequently suing. So we've also got examples of unethical research, which also puts fear into just the general population and might put people off participating in trials. Next slide, sorry. This is looking at reports from 87 countries between 2019 and 2020 on misinformation, which has been a real facet of the COVID-19 pandemic. If you look at this, there are different categories of misinformation, anything, the highest one being on the nature of the illness, transmission, mortality, on whether control measures work or they don't work, on treatment and cure, and the causes of the disease and the origin of the disease. So a lot of misinformation out there. And this, as I say, wasn't just from high-income countries that this data was generated, but from 87 countries. So misinformation has become a global phenomena in response to the COVID-19 COVID-19 pandemic. Next slide. The other source of misinformation preceded the COVID-19 pandemic, and it really is about the anti-vaccine movement, if you like, which has been very strong for a number of years. This was a paper in Nature Medicine, which was entitled Dismantling the Anti-Vax Industry, where the author described the multi-million-dollar organizations incorporated mainly in the US, who for the anti-vax industry have training manuals, they tailor their messages for different audience, and they have meetings like trade conferences, like any other industry. But in those meetings, they discuss tactics for deepening people's fears, sowing doubt as to whether people should take a vaccine, deepening vaccine hesitancy, and converting people who are prone to believe this into fully fledged anti-vaxxers. So there's been a lot of information on the anti-vax response to the vaccines that have been developed for COVID-19. And misinformation is quite difficult unless you're a scientist or an expert to disentangle. Next slide. And this is another bit of misinformation, and this came from a meeting that actually I'm attending for 2 days online, which is a WHO meeting looking at a thing called pathogen X. And this was from a comment made by one of the participants that the top danger is incorrect statements from decision makers. If you look at the cartoon on the left, you can see that this cartoon is describing to a healthy person who's confronted with a patient the benefits of wearing masks and explaining the different parts of the mask and why the mask works. What you see in the cartoon below is what happened with one politician in one US state who said, you don't have to wear masks on planes. You do on trains and you do in cars, but you don't on planes. So once you get this kind of confusion of statements, the confusion of science, and particularly confusion that comes from policymakers and decision makers and from scientists, then you get problems with understanding at a population level. Next slide. And then there are public disagreements, and one of the biggest public disagreements, which has also affected South Africa, is ivermectin. And this paper was headed Why the COVID Cult of Ivermectin Won't Die. And despite the fact that this is just one article from the BMJ, that 26 major trials found that ivermectin for COVID-19 had over a third had serious errors or signs of potential fraud. Nonetheless, ivermectin was huge and continues to be supported in many quarters. This is another quote from an article in the publication Think from Timothy Caulfield, where he says, there's never been good clinical evidence to support the use of this drug. The debate over its use is about ideology, not science. One of the biggest harms of this kind of misinformation is it distracts from and creates uncertainty about proven approaches to treat and the prevention of COVID. And as we know, ivermectin has been widely used, perhaps not so much now, but certainly at the peak of our waves of COVID-19, we've had widespread use of COVID-19 and a real belief in many quarters that this is a treatment and also for prevention. Next slide. And then another one, which is about public disagreements and how they can cause confusion. And this is headed, is the debate over the origin of COVID-19 still worth having? And this is the kind of thing that's been published. So finger pointing is a natural human trait. Finding and punishing the guilty can be important, even if only psychologically. But what this paper was referring to was the lab leak theory around the Wuhan laboratory, which said that the lab leak had actually generated the whole COVID-19 pandemic, something that most scientists have now discounted. But this degenerated into China bashing and bizarre attacks on the National Institutes of Health in the United States, and more specifically, strong attacks on Tony Fauci, who has been the lead person in the United States in terms of the whole COVID-19 response. So when you get public disagreements like this, it's very difficult if you are Joe Public reading this to understand what is right and what is wrong. Next slide. And this sort of public disagreement spilled out. I mentioned Tony Fauci on the right. You can see it says Lord Fauci in the inserted picture. And this is very recent. This was from Fox News, where there was a complete attack on everything that Tony Fauci has said as being either misleading or false. So the problem is that when we have public disagreements and personal attacks, it's actually very difficult for the general public to understand and interpret what is true and what is not. Next slide. And then there are other motives, and this is an example. We have huge vaccine inequity, as we know very well, in our continent. And in the meantime, we've got Pfizer and BioNTech and Moderna are making a profit up to $1,000 every second, while the world's poorest countries remain largely unvaccinated. So we're also having very difficult messaging about access to products when we don't have access to products, and what the motive is behind why we don't have necessarily, why for a time, certainly this region didn't have access to vaccines. Next slide. So these are some of the challenges that we've had in terms of communication, but we did do a lot of things right. And if we look at what I think are some of the things that we've done right, we've had extraordinary success in surveillance, and the South African teams that have been doing this have been widely accoladed for their efforts. Diagnostics have come on enormously, and SAHPRA, the Drug Regulatory Authority, was very, very strict about what they would approve. And that was to the benefit, because we only approved the best quality diagnostics. And we got a lot of stick for that as well. Paxlovid is another more recent intervention as treatment. And that, again, is something that is now being used widely in high-income countries. The vaccine revolution on the right-hand side has been huge. I mean, it probably has been one of the biggest breakthroughs. And the COVAX facility that you see in that middle photograph has really pushed, with difficult to get off the ground first, but has pushed for global and equitable access. And we're now looking at manufacturing on the right-hand side at the bottom, vaccines in South Africa. But also important was the fact that science has become more open during this period, with many scientists now wanting to make discoveries more open and accessible for rapid deployment around the world. So there have been many breakthroughs, and that really, for me, has countered. Most people believe in vaccines, and many people are getting vaccines. So there have been many pushes against all of that messaging that I showed you previously, and all the uncertainty that I showed you previously. Next slide. But it's very important in the context of all of this to have had regular communication. And this is the Department of Health, the NICD, was putting out daily COVID stats reports. And in terms of how people perceive outbreaks and what is happening, having that sort of daily transparent communication has been extremely important. It's now reduced, it's now gone down to weekly, but for a while, in the height of the outbreaks that we've had and the waves that we've had, having that daily report, particularly for scientists and clinicians, was very important. Next slide. And then this has sort of moved on, and there's been in June of this year, last year, but there was a global conference on how to communicate science during health emergencies. So actually this issue of, on the one hand, there's bad news. On the second hand, the data evolves very quickly. And on the third hand, there's good news. How do you communicate science with that amount of change during a health emergency? And this was a consultation that really looked at how we should be taking science forward. Next slide. So the first thing is, why should we communicate? Well, the first thing is to build trust and public understanding in science, and trust is incredibly important. The social media context, which is so rapid and is a platform, as we know, for people who believe and people who don't, requires very proactive strategies. It's not something that you can sit back and just hope that the newspapers will cover all of the social media that's out there. Honesty and transparency is incredibly important in communicating, and communicating uncertainties is important. Just look at the data I've just shown you about what do we know about long COVID? What do we know about the vaccines? Do the vaccines work now? What do we know about treatments? Are the treatments working? People want certainty, and that's difficult in times of uncertainty, but honesty is incredibly important in the communication and giving evidence-based answers, and also ensuring that people and the public understands that the policy issues are reflected of evidence-based answers, as opposed to the example I gave you about the mask wearing not on aeroplanes. Persuade people to adopt positive behaviors for themselves and others. That's probably the most important thing. And I think in the height of all of our waves, that's been the thing that actually I think South Africa has done relatively well in the height of the waves, the distancing, the mask wearing, the sanitizing at that stage. And very importantly, countering misinformation, disinformation, which certainly has been one of the biggest challenges, as I showed you with all of those earlier slides. Next slide. And then the question came in this WHO discussion was how to communicate science. And here are just some tips that came out in this recommendation. What you need is trusted, credible communicators who understand science. And then the aim of that communication is to help people engage in protective actions. You need simple, clear messages that are based on facts, that are transparent, that are honest, says this is what we know and this is what we don't know, and explain at the right level to the right audience, to decision makers in one way and perhaps to the general public in another. Honesty, that issue of stating what we know and what we don't know, and I just showed you 2 slides on long COVID, we still don't know a lot about that. We must listen to our audience and engage in two-way communication. And certainly I think that we found that that has been some of the most important lessons learned, particularly, for example, if you're using a vaccine and then you have to withdraw the vaccine, you know, actually understanding what other people think about that is incredibly important. Separating science from politics, and this from the, as someone who's been working with the regulator in making commentaries on COVID-19, has been very important. Stick to the science and don't get pulled into a ring which is not your ring, the political ring or the disinformation ring. Stick to the science and repeat it frequently. Rapidly respond to mis and disinformation and use the science to do that, but also find out who is most likely to be influenced. And in fact, many studies show that it's older people. Don't repeat the anti-science rhetoric. So don't say, well, you're saying this, this, and this, but I think that, because then you're immediately on the back foot. Say what you believe as a scientist or a regulator or a policymaker. Speak to what you understand and you're confident in talking about, but also look at where the sources are. The sources of information are incredibly important. Are they credible? Are there vested interests behind those sources? And then spot disinformation. Anonymous sources, conflicted sources, and the credibility of websites are all incredibly important. And this is one such website called Africa Check, which gives guidance about how to really screen out real and solid information from information that is potentially disinformation or not verified. Next slide. I thought that this was, I just put this in as we're talking about information because I thought this was very interesting. This was from Nature. It looked at the sources of COVID-19 information for vaccine accepting, hesitant, and resistant groups in Ireland. And if you look, first of all, in the two gray circles in the middle, where you see the top bars are the gray bars. This is from the internet and social media, where this is where you're getting quite a lot of resistant groups listening and hearing resistant messages as a source of information. If you then look at the blue groups, the television and government agencies, you can see that the blue bar is the highest, where people are accepting and they're trying to put out a more fact-based message. And then just in the red at the bottom, you see that in terms of information for vaccine, accepting, hesitant, and resistant are all pretty much the same. And this comes from health professionals who are obviously trying to be very measured in what they're saying. But you can see that according to which media outlet you look at, you're going to get very different messages according to this data. Next slide. And then improving science literacy. And this has come out very strongly as something that we need to think about more. And it'll be good to hear what this group thinks about it. So first of all, the importance of building capacity for evidence-based science journalism. And that includes how do we use social media? Because there have been instances where it's been used very well and instances where it's been used to the detriment of a wider public understanding. The need to have both multilingual and multicultural capacity and sensitivity as we try and communicate the science. The importance of multi-stakeholder collaboration with a huge list of who should be involved. But it does include media professionals and researchers and also the policymakers. So a group that we often don't think about but are very, very important are the scientific advisory boards. And every country has now probably got a scientific advisory board on COVID-19 who advises the government. And what do we know about their communication? Well, these groups need to be diverse, but they need to be regarded and indeed selected for being legitimate and independent voices who are able and willing to communicate. And then some of the things perhaps we don't think about enough is actually taking science literacy into schools and into the curricula as we train health professionals and journalists, because we have seen in COVID-19 that science literacy hasn't always been there. And many of us who've given interviews would know that. So does science communication enhance democracy? This is the next question that we were asked to look at. Well, it builds pride in science. If we look at our genomics network in South Africa, that's a thing of great pride. It hasn't always served us well because actually they've been extremely honest and very in us, for example, having airlines cut off. But this is something that is very important. It builds trust in the research process and in researchers. It informs politicians and decision makers. And if appropriately utilized, it should build trust in government and in public health programs, because those we are all assuming are responding to the science and therefore should increase compliance. And it builds trust in regulatory, research and health authorities such as SAPRA, health departments and higher education institutions. So science communication, when done well, indeed should enhance democracy. But this is just one piece of data on trust. And this is looking at cross-country differences in estimated SARS-CoV-2 infection rates. But if you look at this, if you look at the 4 bars, if you look at the left, where you have low electoral democracy and low trust in government, you saw that there was the infection rates were quite high. Where you've got an electoral democracy with high trust in government, much lower. And in between, the sort of the 2 panels in between. But it seems that trust in government, high trust in government and democracy, from this data, those 2 things together appear to increase the uptake of preventive measures and thus decrease infection rates. So the communication, who communicates and in what context, is very important. Next slide. And finally, just to show that that might be true, but there are other ways to think about this. This is a quote that looks at what determines the country's resistance to the coronavirus. And this was just one quote from this paper. The major dividing line in effective crisis response will not place autocracies on one side and democracies on the other, but whether citizens trust their leaders and whether those leaders preside over a competent and effective state. So actually in this paper, arguing against the fact that it's only democracies that can communicate. It's actually about trust in leadership and whether you have a competent and effective state. Next slide. So I'll stop there and look forward to the discussion. Thank you very much.
Thank you so much, Prof. Rees, for a very thought-provoking and stimulating presentation. You've given us a lot of food for thought, and I hope people are recording their comments and questions either in the chat or just on paper to raise towards the end when we're going to have a discussion. We're going to move on now to Professor Moshabela, who's joining us from.
Thank you very much, Dr. Lutge. I appreciate the invitation and also really appreciate that talk from Helen as well. If I can also have my presentation shared, I would appreciate it. Thank you very much. Yeah, good afternoon, colleagues. I want to sort of pick up on some of the things that Helen has stated and essentially try to expand into a broader framework that we can begin to think about. Helen spoke a lot about the science and the contribution of the science to, the pandemic, and also how the science became an instrument through which we could solve problems, but also a source of conflict in many ways, serving different interests. Now, for me, going through the whole experience of COVID-19 and some of the challenges, one of the things that I kept thinking about was how in South Africa, we are so quick to speak to our rights and demand our rights. We want our rights to healthcare, even when the healthcare system is under strain, we still want our healthcare needs to be served. We want to have our rights to bodily integrity. If we choose that we don't want to get a vaccine, that's what we will come up with. We also want our rights to refuse, or deny or question the science that is, being presented to us, whether we are reading this in the media or we are watching it, on TV or on social media, etc. So we are always talking so much about our rights, and we talk less about our responsibilities. When the time comes for us to take responsibility for our actions, including, for example, having to protect other people from infection, then we begin to recoil. Scientists also, as scientists, we also want our academic freedom. We want our space to explore science in whichever way we want to explore, an area that we want to explore. And in general, there is consensus on some of the things that we need to pursue, but also this. So for example, we can agree on ethical frameworks and things like that. And most of us will have consensus on methods and ways of ensuring that we've got robust science. But also we saw how science was also used as an instrument to support agendas that are not of benefit. And I think Helen spoke to this a little bit. So that space of academic freedom can also be exploited by scientists. And then the question is, how are we exercising that freedom in a way that is responsible? Is a question that we have to keep thinking about. But most importantly, as scientists, we emphasize academic freedom, but we forget that academic freedom is a twin principle that goes hand in hand with public accountability. So we cannot just, try to argue for academic freedom and advance academic freedom in our arguments in order to have our way in terms of what we want to pursue. But we also have to make sure that the science that we do, the areas that we study, can also ensure that we are publicly accountable, and there are mechanisms through which we can account to the public. It has not been very nice to see how much trust has been eroded of scientists because of some of the public debates that in general are normally scientific debates that would take place in conferences like one I'm attending now, but also these debates had now spilled into the public, and even scientists were debating each other in public and having public spats. And when we begin to see that, that sort of erodes confidence in scientists. And now when you actually listen to the public reactions of when scientists or academics or professors speak, you can see that people now think that they can actually question scientists. And of course, they might argue that they have a right to do that. But in a way, there is this sort of erosion of trust in the expertise of scientists that we are going to have a long way in rebuilding and restoring going forward as we emerge from the pandemic. The last thing I just want to mention is this issue of leadership. And I think Helen has also spoken to this in terms of decision makers and policy makers. We entrust them with a lot of power, but we also expect them to treat that power with in a responsible manner. We want them to fulfill their responsibilities, and we want them to be accountable. When you now have things like digital vibes and decisions that are made that cannot be explained, like the way, or that are miscommunicated, like the way decisions around lockdowns were miscommunicated, that erodes trust, and it makes it difficult for us to trust and to entrust leaders with the power that they have or exercise over us. Next slide. So with that context that we have, and essentially for me, what I'm framing here, it's a situation where we've got a much broader context that influences the problem that we face, be it COVID-19 or any other health risk that we may have to confront in the current times that we're in or in the future. But what we saw, for example, is, you could, from a scientific perspective, simplify the mechanism of what is happening, where you are saying, look, we've got a variant that is driving a wave that interacts with the immunity in whatever form, as Helen has indicated, be it vaccine or recovery from infection, and all these behaviors. And everybody has a part to play in that. And all of these things will of course happen in context. Now, that will make sense for us. But if you go to the next slide, we have to then take all this evidence that will come from science and take all of that evidence that we have actually processed and synthesized and put it through this wheel, where essentially after we've done the research, we have to translate it into policy. Then we have to innovate in terms of interventions that are going into practice, put them into service, begin to educate people, and ensure that they can receive the information that they need and the services that they need. And then whatever questions that emerge, learn from that, put it through again into research, and go through this wheel again and again and again. And this is a cyclical process that essentially helps us to take the science that we have to put it through policy, practice, and education. And the whole time there is all of these activities happening. Now, normally this is a slow process, and in a pandemic, this was happening very quickly. Imagine now having to process a whole information around variants, information around behaviors, masks and ventilation, information around immunity, antibodies, vaccines. All of this we had to put through this process, and we don't really have a seamless process in our country to deal with this. And as a result, we end up with a lot of leakages. Nevertheless, eventually people will come together, like we saw with the MAC, begin to advise government and come up with a certain approach that the government can take. Next slide. And in South Africa, our broad approach to COVID-19 was really about containment and mitigation. And if you really thought about it, mitigation was about responding to what we were faced. And a lot of the responsibility there was with the state, and was also about protecting the health system, was protecting health workforce and services, and managing severe disease and ensuring active surveillance. I will not speak further about that. That can be a conversation for another day. But I think mostly, just go back to the previous slide, sorry. Mostly, I want to talk a little bit about the role of individuals, the personal responsibility, the area where we are in the public domain, beyond the sort of scientific domain itself. And the interaction of sort of public health and social measures, and the exercises that people have to take in taking responsibility for their health, because that's where the conflict of rights and responsibilities begin to show, and issues of power interactions begin to show. Next slide. So you will then find that, having come up with that approach, that you think that it's an approach that is agreed, and usually in South Africa we say we've got good policies. When you translate them into practice, they don't necessarily give you the results. We knew that the willingness to take vaccines was quite high in South Africa. And so, in certain provinces, it was as high as 77%. And if the willingness to take vaccine was this high, why is it that at the end of the day, we ended up somewhere around 50% vaccine acceptance? Because there's all these people that are in between, that are neutral, that you can convince essentially to become willing recipients of interventions. But those are the people that then get converted into unwilling, the groups that are targeted for anti-vax messages. So we have to act early in order to essentially make sure that we are actively recruiting those people to understand the science and they can benefit from interventions. But trying to get those who are unwilling becomes quite a steep hill. And so we have to, we went through a process of understanding this and came up with estimates that we could reach as high as 70% in terms of vaccine recipients, but we didn't get to that point. Next slide. When you ask people who they trust the most in terms of information, when it comes to vaccine advice, in South Africa, they trusted the doctors and the nurses the most. And this really is a demonstration, again, a different way of looking at it, of the mistrust that we have had to deal with. Health experts, 35%, government, 37%, but the doctors and the nurses were 43% when it came to vaccines. This is the interface where people engage with their health system. The rest of it, they tend to engage indirectly. They don't engage directly with government. They don't engage directly with health experts. It's often done through the media and so forth. And because of that, they feel like there's a lot of filtering that happens, a lot of curation of managing their narratives and so forth. But when they engage with doctors, those are the people that they tend to trust. But even then, it was only 43%. You would have expected that it would be quite high. Next slide. The same doctors and nurses, when you go to them and you ask them what are their sources of information for COVID-19, you can see that in blue, sorry, stay with the first slide, previous slide. Yeah, the source of information came mostly from, they said that they get information from the National Department of Health and the WHO. But if you look at scientific journals, it was only the medical doctors that relied mostly on scientific journals. The nurses and other healthcare workers don't rely so much on that information. But what was really interesting was amongst the nurses, 27% relying on social media, nurses, and news websites was 47%, and other healthcare professionals, other than nurses and doctors, was 57%. And so for us, this was showing us that, there is this sort of mainstream media and social media, it's beginning to play an important role as a source of information. It had a lot to do with the fact that new information was coming out so quickly that there wasn't even enough time to process it through the official workplace circulars that people will normally, healthcare workers will normally get information from. And yet, these are also the people that the public trust in terms of getting information. Next slide. We also then found that in terms of their own well-being, the nurses and the doctors themselves faced a lot of distress. They were so scared of COVID-19, of getting COVID-19. Their colleagues were getting infected. Some of them were dying, and they were very frustrated. And you could see the level of distress among nurses as high as 25%, and amongst doctors about 15%. And normally severe psychological distress should be as low as 0 and 1%. For it to have been this high during the pandemic, especially between the first and the second wave of COVID-19, this was really showing the level of distress amongst healthcare workers. Now, you ask yourself when you're looking at this to say, how are these people in the distress that they have going to be able to engage with their own patients? And this was not only in the public sector, it was also in the private sector. Even though the public sector had a lot more distress, psychological distress, than healthcare workers in the private sector. Next slide. So what we are now seeing, whether it's healthcare workers or whether it's the public, there is a myriad of realities that people face. Issues that they face are not as simple as there's a variant and there is a behavior and there is a immunity. For them, there is a whole lot of emotions. There is fear, there's panic. There is a lot of questions around which information source to trust. And in all of that, you get mis and disinformation. There is a lot of uncertainty, erosion of trust, a lot of complexity. People just don't know how to handle things. At the same time, they also want to be understood as being, they want to feel like they're human, they want empathy. They expect a lot of humility, also not just from their healthcare workers, but also from scientists and their political leaders. Now, trying to get scientific humility or political humility is not easy. And in all of that, they, as Helen said, they also want consistency. When information then changes very rapidly, that confuses them. It just becomes too much for them to navigate. And this is the space in which people found themselves. And we have to then think about, how do we then navigate the sort of engaging with science communication and evidence with the public in the context of these multiple realities. Next slide. So for me, what I experienced during the pandemic was that I had to essentially constantly come back to the question of, whenever I communicate, who am I communicating with? And the audience was important. And in all of that, of course, I have to resolve the sources that I'm looking at, the facts, and they pull out the messages. But then I have to look at the audience to say, in what context are they and what are their values? I found, for example, if I engage with people who are still concerned with their, the basic needs of electricity and water and food, it's not easy to actually draw their attention around the vaccine. And also during the lockdown, when people were very much concerned with socioeconomic issues and their ability to earn a living, it was not easy to communicate the COVID-19 messages. Now then, the question for me was, when is the best time to do it? Because oftentimes we leave this communication too late whenever we have to engage with the public. Again, we have to then think about what will then be the benefits of the messages and for that audience, and the risks for that audience, and the impact for that audience. This also then requires for us to tailor messages to different audiences to make sure that we have a differentiated approach in the way that we communicate. Next slide. And I then kind of came to a point where I began to ask myself, what then is the goal of communication? What am I trying to do? To inform, to request, to persuade, to relay, to entertain, what? But the thing that I came back to, and Helen referred to this, was behavior change. That whenever you engage during a pandemic and you, for health reasons, the goal is just not to share, it's not only to share information. You have to inform, to share information, but that doesn't mean a person is going to comprehend. When they comprehend, it doesn't mean that they will have knowledge, and that knowledge they can also be able to share, not necessarily. And when they do have the knowledge, it doesn't translate into skills, the life skills that they need to put that knowledge to good use. And then when they do have the skills, it doesn't necessarily mean that knowing how to do something means that they have the confidence to do it. And when they do have the confidence to exercise the skills, it doesn't mean that they are going to necessarily change behavior. And when they do change, they may change sometimes, but not all the time. doesn't necessarily translate into habit, and habit doesn't mean that they will go on to influence other people. Next slide. So we then have to deal with this issue of how people then adopt behavior. We got to a point in South Africa where people were willing to change, to accept vaccines, for example, and you get the early adopters, you get the early majority, but trying to get the late majority and those on the far right was very difficult. And we never really got there because they, again, as we said, they were actually captured and influenced a lot more by the anti-vax movements. But we have to constantly think about this in terms of who we are targeting at what point so that we can tailor our approaches and innovate around them. Next slide. For me personally, this is what I ended up having to resort to think about constantly. If I communicate, I'm communicating to help people reform, change behavior. And I drew from health promotion messages to say that I'm dealing with a lot of people that have a lot of anxiety, and I need to change that into agency. But once there is agency, then also there needs to be action. But action for one person is not enough. We actually need to get to a point where there's collective action. And in all of that, what I encountered was this real problem of power over and power within. And whenever we have to engage, people look at you to say, are you someone with power over me? And that's why the issues around politics and political parties beginning to play a role also divided the messaging around COVID-19 and vaccines, even though they shouldn't have. And people were looking for those who are neutral with influence or power, who could then be able to be reliable sources. But all of these issues of power are at play behind the scenes. And often the times, those of us who are researchers and scientists, we don't want to deal with that. And as Helen said, we don't really want to deal with the politics, but politics are really about negotiating power. Next slide. So for me, I want to propose that as we move forward, we begin to think about whether we could find some sort of interface for those who can focus on scientific knowledge production and stick to the science, but also accept the reality that we live in a complex context of a both political and scientific context. And one way of bringing those things together is go beyond just science communication, but to begin to think about science diplomacy as a way of making sure that we are intentionally engaging different stakeholders so that we can find consensus. And for me, engaging in a diplomatic manner around science is more than just communicating. It's also being intentional in terms of wanting to persuade, and also making sure that our persuasion is informed by science. It's protecting the interests of science, but really actively restoring the trust in the science. We have to be activists for science to make sure that coming out of the pandemic, people are not going to give up on science. We have to actively engage in how important science remains so that we don't necessarily leave that space to other people with other interests. And as Helen indicated, who are actively engaging and strategizing. We also have to strategize on how we are going to make sure that science actually impacts society. Next slide. We had to do this with HIV. We had to engage in a diplomatic manner across many stakeholders. We had to mobilize all of society to do it. And we did it all giving the power to the people that were affected with HIV and infected with HIV. We had to do this. But it was really almost like, when I think about it, almost like contained. When we move forward from COVID-19, it's not just contained, it's not just issues contained within one population group. This is now more of a broader society where we have to engage diplomatically around science to ensure that we are going to protect the interest of people around how science can benefit them. Next slide. We want to make sure that going forward, our health systems are going to be high quality. But just the last point there, A high quality health system needs to be valued and trusted by all people. Valued and trusted by all people. It doesn't just give you health outcomes. It doesn't just respond to health needs, but it needs to be valued and trusted. And building and restoring that trust is going to be important. And I think that science diplomacy may be able to help us to rebuild that trust. Next slide. The public health framework in itself speaks to issues of democracy, in my view, because it emphasizes social justice as the main thrust of what we do. And it also ensures that we achieve health benefits, we do them efficiently, but we also have respect for human dignity. And so putting people in the center is going to help us bring back to an approach that is going to put the dignity of the people that we are serving in the center. But we cannot necessarily do that without the instruments and the interventions that we need from science and public health that can help us to do this. And so this framework is much broader than what we often see in biomedicine, which is really a framework that is simplified around autonomy. And we just say, well, people have to give consent, for example, or beneficent. As long as there is benefit, that's good enough. It actually shows us that there is a broader context that begins to speak to issues of democracy that I think are important, and really social justice becomes a driver for that. And in a way, I feel like it's easy to abandon this fact in the science debates if we are not intentional about it. Next slide. I therefore want to finish off by saying that we are all entitled to health for all, but for us to achieve that and make sure that everybody benefits in an equitable fashion, we're going to need people-centered approaches. We're going to need interdisciplinary and transdisciplinary approaches. We're going to have to work across different sectors. We need to engage in a way that embraces complexity and systems. But if we are going to do all of this, we're going to need a new model of engaging in science that I think is going to help us to bridge the different gaps. And if we did that, I'm confident that we may be able to restore some of the harm and damage that has happened to science during this pandemic. But we cannot necessarily leave things as they are, in my own view. And I hope that can then contribute back to issues of democracy that we are discussing today. I will stop there. Thank you very much.
Thank you so much, Prof. Moshabela, for a great presentation, a very rich presentation with a lot to think about again. And again, I just want to remind the audience to please record your thoughts, your comments in the chat, or else save them for our discussion, which will happen after Professor Harber, who is our third and final speaker for today. So there is one hand, but I'm going to leave it until after Prof. Harber's presentation, if that's okay. It will be really interesting, Prof. Harber, to hear from someone who's not a scientist. We've had two scientists so far, but someone who's a journalist. And so I'd like to hand over to you, Prof. Harber. The floor is yours.
Thank you very much. And thank you for inviting me to take part in this exchange. I was asked to respond to the two previous speakers, so I don't have a prepared presentation in the same way, but I hope I can make a few remarks in response to what they've said that can help inform and take the debate forward. It's clearly a very important debate and very important discussion to have, and now to assess what we got right or wrong in communicating the science around the pandemic, and how we should think and plan to do it better and differently the next time around. I thought Professor Rees, I thought Helen made some very important points. One about the history of disinformation and science skepticism, showing that it's not new. It's not unique to this pandemic, but it goes back to the very first vaccines. And I think it's an important point to keep in mind when we deal with these things. And I also think that she showed quite clearly how, you know, we want to be putting out messages and communication that are clear and consistent, and straightforward and simple. But at a time such as the beginning of the pandemic, it's complicated. It's not clear. We don't know. The scientists don't know as much as we wish they knew. And that leaves one with real dilemmas in trying to tailor the message and make sure the message is clear and impactful, and appropriate. And I think that there's important things to be said about how one deals with uncertainty at a time when people are hungry for certainty and clarity. I was most intrigued by Professor Moshabela's graph on who was most trusted, and that doctors and nurses were at the top, because I think there's very important messages there in how and who communicates, and how one ensures that those most trusted are at the forefront. You know, I think it's come through both the talks that trust is the central issue here. And I think we have to say that we live at a time when trust in state institutions is at a low. People are not easily trusting state institutions, state officials, politicians in particular. And that is a real weakness. And I think we need to take a long-term view of what needs to be done to rebuild that trust. I think we also have to say that we know we're in a situation where our media system is much weakened. Not just here, but around the world, because of technological change and the collapse of the old media business model. We are in a period of rebuilding our media. So that complicates the attempts to manage clear and consistent messaging and to deal with disinformation. These are social, political, economic realities that we have to confront if we're dealing with these problems and issues. And one thing that came clear to me as I heard the talks is that I think we need to think about the immediate, the short-term needs for what we would do differently if there was another crisis of the sort presented by the pandemic. And the longer-term rebuilding we need to ensure is in place to try and make sure that we better equipped for the next pandemic. The shorter, more immediate one relates, I think, to being, you know, if you ask me, I would say that there should really be a crisis communication plan for the state that's much better thought through and organized than we had. And one hopes that happens for next time. It has to work on the assumption that, yes, the first step is for the national leader, the president, to address the nation and give the core message, and to do that regularly. But that should be followed by a whole range of approaches, of strategies, of actions to support, to spread that message. I think important thing to realize that we live now in a society where it can't be a lecture, it can't be a one-way process. We have to see that it's a conversation, and that to build the trust people feel they need to be part of that conversation, not just to sit and listen to a lecture from the president. I think it's important because, for example, there were many complaints from journalists that they were not given the opportunity to put questions to the president. And I think that speaks to the same issue. It has to be seen as a conversation rather than a lecture. That's the demands, modern technology enables that, and that's the demand of people if they are to trust the messaging, I think. It doesn't mean to say it mustn't be managed, because one can engage in conversations with journalists, for example, in different ways. They can be briefings, they can be separate briefings, they can be on or off the record briefings, but a much more systematic attempt to engage journalists and all the other important players in that conversation is, I think, a requisite to follow through on the core message that comes from the president. I think what needed to follow the presidential messages and the messages from the very senior medical people who were communicating alongside the president was a range of secondary communication that reinforced and supported that message. Now we know that tragically there was budget for that, but it was much of it was abused, to put it politely, and clearly that was a problem in ensuring all the follow-up that was needed to reinforce and support and continue the messaging. But I think what came through in the discussions is a need to think about some long-term building. Much was said about science literacy, and it's something I would absolutely reinforce. We all learned a lot about science. All us non-scientists learned a lot about science in the first weeks of the pandemic. I can recall journalists saying we all had to become vaccine experts very quickly. And I think in the long term, we want to ensure that there is better science literacy among groups like journalists, but in society generally, much more wider in society. I think Helen, it was, who talked about taking it into the schools and other institutions. And I think that's absolutely important, that next time around, we want a society that is better equipped because it is more science literate. And I would say the same for media literacy. And by media literacy, I mean the capacity to understand critically the role media is playing and the role of information and disinformation, and in particular, the critical capacity to discern misinformation, to spot misinformation, and to deal with misinformation. I think what became clear through the pandemic is that a much more broader systematic approach across our society to address media literacy alongside science literacy would have us much better prepared for critical moments such as this. And again, I think that's about taking to the schools and the universities and companies and civic organizations and trade unions to say that we really need to ensure our population is more science literate, more media literate, and therefore more able to deal with the challenges we've heard about today from both our speakers. We are all grappling with how to deal with disinformation. So let me just summarize that problem as I see it, because I think it will help the discussion. Disinformation is not new. There's always been attempts, innocently or maliciously, to spread disinformation, misinformation, often for political gain, often for financial gain. It's important that one understands those motives as it's part of spotting it and dealing with it. The particular problem we have at the moment is that social media makes the capacity to spread disinformation much quicker, much wider, much easier, and therefore much harder to manage. Core to this debate is the question of how we manage our media institutions in a way that deals with disinformation. Around the world, people are debating where that responsibility lies. Do we want the big tech companies to decide what should be in the public debate and what should be removed from the public debate, especially when we see that some of them, at least, if certainly most, or perhaps all of them, all of the big tech platforms, have shown a reluctance or an incapacity to deal with disinformation. And that's a core problem that we have to face up to. We have to ask whether we trust the Mark Zuckerbergs of the world to decide what is information and what is disinformation, and whether we trust that they have the desire and the capability to do it. It's a hard question, because does it lie in their hands, or does it lie in state hands? As a long-time freedom of speech activist, I would be very wary of putting the power in the state to decide what is wrong and what is untrue and what is disinformation, because it's a power so quickly and easily abused. When the government introduced the regulation under emergency conditions to stop disinformation relating to the pandemic, it made me extremely nervous, and it was interesting that it was a regulation never actually used, because I don't believe it's the way to deal with disinformation. I don't have easy answers as to how one deals with it, but I think it is something we need to confront and deal with. Certainly the core is to drive the agenda with accurate, solid, reliable, trusted information. And certain things are required for that. It's required to come from trusted individuals and institutions. We have to rebuild and build that trust if we want it to work. We have to make people more science and media literate to deal with it. We have to equip them with the tools to spot and spot disinformation and learn how to verify information themselves. We need to rebuild trustworthy media institutions which can convey and support that message. Unfortunately, we have at least some media institutions that have gone rogue, that have broken with our systems of ensuring news media coverage is fair and balanced and as accurate as possible. And that's a problem we have to face up to. You know, what is not often known is that the critical change in America, because, you know, American media is so influential around the world in these questions, was the removal of the fairness doctrine in American media in the early 1980s under the Reagan administration. The fairness doctrine said that if you were a broadcaster with a license, there were fairness rules that you had to comply with, the right of reply, accuracy, etc. Early 80s, the Americans removed that doctrine on the grounds of I think the mistaken and misleading grounds of enabling freedom of expression. And that opened the door to what became the right-wing radio presenters, and eventually the likes of Fox Television. We are fortunate, I think, in this country that we still have regulatory rules that demand fairness and balance compulsorily in broadcasting and in a voluntary system in print. As I say, that system at the moment is weakened by the fact that some will not be part of it. But I said that as background because we are going to have to think of the long-term relationship between scientists and the media, and part of building that relationship and building the trust in that relationship will be about rebuilding a media system that is strong and authoritative and trustworthy enough to deal with it. I think let me end there and hand back to you so that we can discuss it or take questions or queries.
Thank you very much, Prof. Harber. It was great to hear from you. There are some queries and comments in the chat. One is from Leslie Swartz. And so I'm going to invite you, Leslie, to speak. I think Kuto can unmute you. So please do go ahead, Leslie, with your comment.
Hello, thank you. Can you hear me now?
Yes, we can. Thank you.
Oh, good. First of all, thank you very much for this session, and thank you to all the speakers. I'm really struck by the challenge that scientists have in the context of pandemics, but also in terms of other pressing and wicked problems like climate change, for example, which we don't hear that much about. And I edit the South African Journal of Science, and every single day I see people trying to communicate about science to scientists, which I think is much easier than communicating to these complex kind of publics, and not actually being able to do this effectively. So we end up, rejecting their work. We run various workshops and so on to try and deal with it. But I think it's a much more serious problem that we have, is that if we're making these, we have to make these demands of scientists. You've been very clear about that they learn these communication skills, but it's not part of curricula. We've got massification of higher education. It feels to me like we need, quite apart from the pandemic, although it's brought a lot of things into focus, we need to look very carefully at serious science communication as part of science training, but that takes time and resources and so on. And I'd be interested to know what the speakers think about that. Thank you.
Thank you, Leslie. I'm wondering which speaker would like to respond. I don't see any hands up. Maybe I can ask Prof. Rees.
No, I think it's becoming increasingly important that we learn how to do this, because I mean, certainly in the average medical curriculum, you're not taught about communication. Yeah. And some of us have kind of taken it more seriously as we've gone through our careers and have sort of spent some time trying to think about, when you give a talk, if you're on the media, you three main messages and you revisit the messages and all of those kinds of things. But I think it is something that we really need to think about, because we're countering now an avalanche of mis and disinformation. Yeah. So, and this whole idea about who are the trusted communicators. How do you make a trusted communicator? Not everyone likes communication, no amount of training is going to to change that. So we need to identify those that can. But media training, I think, is something that's extremely useful and important. And it's not something that we do or do very well. But just in terms of also, one of the issues here is also how do the public get to identify, for in this case, good science from rogue science, and that's much more difficult, because with the speed of coverage and the number of different avenues for sending out of messaging, it becomes very difficult. I mean, I do remember for many years this has been a case, but if going back to AIDS denialism, I always remember one thing I learned there was, it's bad news when you go second, because then you're and you're listening to the AIDS denialism, you're listening to the anti, and it's very tempting to get into that boxing ring together and listen to their, And so one thing I certainly have learned, certainly during this pandemic very strongly, is to stick to your parallel track. If other people are bringing up all sorts of things, but you have clear messages you want to get out. I mean, one thing I have learned is to try and avoid that scenario where you enter their space. The minute that you've done that, the disinformation, the misinformation, once you've the space, it's much more difficult you're sounding defensive and you're on the back. But I think that we do need to think about this with the speed of media that's going out, is how do we pick up the things that are of concern. We have it with HIV, with beetroot and garlic, and we've got it now with anti-vax very strongly. So how do we pick that up, and how do we train all sorts of professionals, but also communities, to differentiate good messaging from rogue messaging? I don't have an answer. Anton then might be a good person as a journalist to consider that.
Thank you, Helen.
Perhaps I could come in there, or if that's okay. I think that it's absolutely essential that communication and writing skills be taught to scientists and doctors. Now, I know some people will never make communicators, and some people are natural communicators. That doesn't mean to say that that everyone won't benefit from understanding and having those skills. I mean, the first problem is that many scientists are scared of dealing with the media, and there is nothing worse than fear of the media and journalists, because the audience can read that immediately, and it makes people defensive. And as Helen says, and not engage on their own terms and getting their messaging across, getting into boxing matches with anti-vaxxers, for example. But the journalist's role is to stand between the scientists and the public, and to be that communication channel. So while scientists have their role and journalists have their role, and it's quite important to think of both, I think, as part of a kind of symbiotic relationship, hopefully, in dealing with it. Thank you.
Thank you.
The one thing I can add is that it's a good point about learning how to communicate within your discipline. I think if one cannot communicate within the discipline, it becomes even harder to communicate the message from the discipline to an audience outside of that discipline. Because essentially what you will be trying to do is to take the messages from within that discipline as evidence emerge from your research, to try and communicate it to people outside, then that requires for you to let go of the jargon. But it's not easy to do that when you don't even communicate well with the jargon. I think that it's a lot more forgivable if one can communicate comfortably within the discipline and struggle to communicate outside of the discipline because they may be limited by the scientific jargon. I think that one of the things that we have to also think about is not just the sort of communication of the evidence that we produce, but I think the interpretation of the evidence produced by others. And going further to say that the synthesis of the evidence, because during this time, I think what I found myself doing a lot was synthesizing evidence from other people. And that sort of critical appraisal of evidence is not something that comes easy, because then you have to synthesize the evidence and then distill the messages and then find a way to communicate those messages. And I feel like it just felt like a higher order function, which was taking a lot of time and a lot of effort and energy. So I would add to what you're saying that as we teach them about how to communicate within the discipline, we also have to really think about how to synthesize evidence much early on, because then that gives them the skill to be able to weed out what is rogue and what is robust and legit.
Thanks very much.
Thank you, Leslie, for your comments, and the speakers for their responses. Unfortunately, we've run a little bit over time, and I think we're going to have to close in the next minute. I'm sorry, because I see there are there are a few more very interesting comments in the chat from Mark and Mobile. So I'm sorry that we can't engage on those more fully. But I need to wrap up now. I want to thank very much the Academy of Science for organizing this webinar, Dr. Kutso Palani for putting it all together, and our speakers, Prof. Rees, Prof. Moshabela, and Prof. Harber, for very, very interesting discussion, for the many new ideas that have been generated and the many new areas that we still need to explore. Thank you all for joining us, and we hope you'll enjoy join other ASSAf webinars as they are advertised. Thank you, everyone, and have a good afternoon.
Thank you very much. Bye-bye, everyone.
Thank you. Bye, everyone.